All right, hey guys, this is Dr. Daniel Leonard with Central Ohio Spine and Joint. We're really excited. I've got a good friend of mine and a colleague today joining us. So, Chelsea, why don't you introduce yourself?
Sure. My name is Dr. Chelsi Day, and I am a licensed clinical and sports psychologist. So I focus on mental health and mental aspects of athletics, both in the performance aspect and in the more psychological aspect.
Great, awesome. Sorry for the quality of the video today. We're going via Skype, but hopefully you can still hear the audio really well and see us both. We're actually really bummed because Chelsea just moved out of Columbus over to Indianapolis, but she's still a really good resource for us. So I asked Chelsea to talk with us today about a couple different topics. You know, in the clinical setting, when we deal with athletes, the what we call psychosocial aspect of pain and of injury, I think, is really overlooked a lot of times. And she's just going to talk briefly about some of the things that she sees on the psych side. Once some of these athletes get injured and some advice she has. So why don't you tell us a little bit about when you're working with athletes that are injured, what are some of the things that you see?
So one of the biggest things that I remind athletes of, and across the board, injury or not injury, one of the biggest things I say is that our body believes everything that our mind tells us. So when we're battling injury and we are really thinking about our pain and we're kind of ruminating about it and we're stuck on the fact that we're hurting and we're thinking how this pain is never going to go away, our body starts to believe us and it can actually intensify some of our pain. We know that the mind has a really good ability to interact with pain, to interact with the physical aspect of it. We always think of the psychological component as being really separate, but where does our psychological component come from? Our thinking comes from our brain, which is housed in our body. So it's all kind of part of this body process. So when I work with athletes with injury, we talk a lot about thinking about the pain as a message from the body. So rather than being stuck on this pain and wishing it would go away and being really upset that we're even dealing with the pain, I always challenge people to try to really consider what the pain is a message about. So a lot of times pain is a message from our body to tell us to take it easy or to let us know that there's some damage. And so the physical piece is actually focusing on what we can do physically to heal the damage, but the mental piece is understanding what the message is and knowing that the pain will always come and go. Everything in life kind of comes and goes, and pain is the same way. It cycles. We all experience varying levels of pain throughout the day, whether injured or not, but especially when injured. And when we can focus on the fact that the pain is transient and that it's going to get worse and it's going to get better at times, it allows us to focus on the message, focus on the healing, and allow us not to get too caught up in the fact that we're experiencing pain and focus on the fact that we're going to get better. We're going to be able to reduce this pain if we focus on the things that we need to do physically and mentally to make sure that we don't just get pulled down by the idea that pain is present.
Awesome. Again, in the clinical setting, what I see sometimes is it almost becomes a vicious cycle. We worry about our discomfort and our pain, which creates stress and anxiety, which I'm assuming from your standpoint is a major player in the mental aspect of injury and pain. Can you talk about that a little bit?
Yeah, anxiety causes our pain to get worse, and pain causes our anxiety to get worse. So we start to feel a little twinge of pain. We start freaking out about what it might be. Does this mean my injury is getting worse? Does this mean that I'm not getting better? And when we're anxious, it really affects every body system, from our mental thoughts and those obsessive rolling thoughts to muscle tension and holding tension in places that we shouldn't be, to even the way that our motor movements occur can be less fluid and less smooth, which can cause increased incidences of injury. So being able to reduce our anxiety through strategies of relaxation, even writing down some of our worries. I challenge people to, especially when it's pain throughout the day that brings these spikes in anxiety, writing down, what the thoughts are, what the anxieties are, and dealing with them later, so that we can try to keep our body relaxed. We can try to adhere to the physical suggestions we've been given, rather than getting so caught up in all the worry about the pain. We can start to reduce that anxiety by really trying to relax our body and our mind, and focus on the fact that hopefully we're receiving the care that we're trying to receive and trusting in that process a little bit.
Yeah, great. Okay, so I'm going to put you on the spot here, but one of the things that I hear a lot within the clinic is people talk about letting pain be your guide. So in exercise or in sport is let pain kind of dictate how you go about things. And my opinion on it is a little bit different. Is I do think that you have to let pain guide how you accomplish things, but at the same time, from some of the pain research that we read, is even though you have pain, that doesn't mean that you're creating more structural damage. At some point, you have to be able to break that cycle. And breaking that cycle sometimes goes from being able to get through a movement or get through exercise and realizing, wow, I didn't make it worse, even though there may be a little bit of pain. Would you agree with that?
Yeah, I actually, there's a theory in sports psychology that we refer to as the inverted U. So the idea that when we experience stress and anxiety, it's kind of in the shape of the U, where on each end we have no anxiety, no pain, high anxiety, high pain, and that both of these are messages that something's wrong. Now, obviously with pain, not necessarily quite the same, but that there's an area in the center that is some level of anxiety, some level of arousal, and therefore sometimes some level of pain, whether emotional or physical pain. And that there's a good area of that not all stress and anxiety, not all pain has to be bad, that we listen to our body, for sure. We listen to the pain, we listen to the anxiety, we listen to all of these things, but we need to know, where is that balance? Where is that middle ground where this isn't damaging, this isn't detrimental? And learning for ourselves, again, whether it be pain, whether it be anxiety, whether it be arousal, there's always some spectrum that we don't need to panic about, we don't need to freak out about, and it's knowing where those boundaries are instead of trying to avoid it and get rid of it altogether. That may not necessarily be possible. I tell people all the time, you may not ever totally get rid of some degree of discomfort, emotional or physical, but if we can find where that balance is, where it's not excessive and it's not damaging and burdening, then absolutely we can deal with that. So I think we often get paralyzed, whether it's pain or emotion, physical or emotional. We get paralyzed by the fact that it's present at all, rather than thinking about it and understanding what it is communicating to us.
Absolutely. Awesome. Great. Okay, well, thanks. We really appreciate you spending a little bit of time with us today, talking about some of the things that you do every day. Like I said, this is one of the areas that I feel is really kind of overlooked in dealing with injuries and dealing with athletes. So again, I really appreciate it, and thanks for sticking with us today.
My pleasure.